Good afternoon, everyone. I am Kelly Waters, a health communications specialist in CDC's Center for Preparedness and Response, Division of Emergency Operations. Thank you for joining us for today's EPIC webinar on the 2019 hurricane season. Today, we will hear from Bill Rich and Vivi Siegel. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on our website, emergency.cdc.gov/EPIC. The course access code is EPIC, capital EPIC 0717, with all letters capitalized. To repeat, the course access code to receive continuing education units is, in all caps, EPIC 0717. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after our presenters have finished. Closed captions are available for this webinar. We're fortunate to have Vivi Siegel and Bill Rich as our speakers today. Vivi Siegel is a senior health communication specialist for CDC's Division of Environmental Health Science and Practice. Vivi has a background in public health and journalism and a professional focus on emergency risk communication and environmental health. She has been a health communication specialist at CDC since 2005. She helps lead communication activities for natural, chemical, and radiological disasters, including the hurricane responses for 2017 and 2018. Bill Rich serves as an emergency management specialist and disaster planner. He helped found the National Disaster Medical System, becoming a founding member of Disaster Medical Assistance Team GA3. While at CDC, Bill has taught first responder, mass casualty management, basic and advanced cardiac life support, disaster planning, and all hazards preparedness in 12 countries and numerous domestic areas. He has completed an extensive list of mission deployments as a medical officer and a logistics responder. Thank you for joining us today. Bill, please begin.
Good afternoon. I'm happy to be here today. I hope you find some value in the presentations. Let's jump right into them since your time is far more valuable than mine. Next slide. First, the forecast. Everybody loves this part. And we're already in the season, as Hurricane Barry has proven recently. Activity for this year is predicted to be slightly less in intensity compared to last year. We're looking at a total predicted of 13 named storms, 5 hurricanes, and 2 major hurricanes. That's what we expect. Don't get real wedded to that number. Remember, the weather does not get the memo and is on its own criteria, its own schedule. If you prepare for the worst, you'll only have good surprises. Pessimists are the way to go in this business. Next slide. Don't rely on a 120-hour warning model, even though that's currently real trendy in the planning community. Some of the storms we faced in the last couple of years and some that we will probably face this year, we may only have 24 hours or even less of warning because of the pop-up storms in the hot water around the Gulf, particularly. If you prepare yourself and your family, it'll enable you to do your job because you won't be spending all your time making sure they're safe and reassuring them. And it's your job of having a family. A direct storm impact is not required for there to be personal or professional impacts from a hurricane. Some of the greatest impacts have been indirect, such as when water drains down a river basin from an impact farther upstream. Mississippi is a classic example of that, and we will be watching the effects evolve as we go through the next several weeks just from Barry's impact. Some of the worst historical impacts, historical events, have occurred because of slow-moving or stalled tropical storms, not even hurricanes. But if a tropical storm stalls out, like the classic one did over South Georgia a few years back, the rain impact can be horrifying. It can flood out major areas, impact lots and lots of people, totally change their lives. So it doesn't have to be a Cat 5 hurricane to have catastrophic impact. Next slide. Stuff that gets compromised when you have an impact from a storm. One of the very first ones that the planners are starting to watch now is dialysis clinics, both because of power loss, clean water loss, and also transportation impacts. Dialysis is very, very vulnerable as a result of an impact, and we saw this in the preparations for Barry to come ashore. Patients were dialyzed ahead of schedule to let them carry through several days of non-access to their normal system. Oxygen concentrators. Lots of our citizens are on concentrated oxygen in their homes or in their places of work, and if they don't have reliable power, their access now has a stopwatch ticking. Home IV therapy, the same thing. Home IV therapy pumps work great as long as they're plugged into the wall. As soon as you've taken away standard electricity and they're on battery, now you have that stopwatch working against you. And if local medical support cannot access these patients because of transportation impacts, your problems are multiplying. Power loss at medical service companies, direct contributor to the ones we were just talking about with the home IV therapy. If the service companies cannot get out of the house or cannot access their patients, there's a gap. It'll have to be dealt with in your planning. Hospitals always have generators, but how much fuel do they have in terms of runtime? Where are the generators physically located? If they're in the basement, this is a problem if the hospital floods. This was driven home in a number of places, but especially during the floods in Dallas years ago. Radio communications backup. Radios are a critical part of the hospital to EMS field response. That's how you get medical control extended over your medics out in the field. There is a limitation to how much radio equipment and training and operators there are at a typical hospital. Hospitals are chronically understaffed for a number of reasons. Keep that limitation in mind and try to have a plan B and a plan C for communicating if the impact directly hits the hospital or interrupts the ability of their radios to work. Taking out a tower comes to mind. Loss of medical refrigeration. When certain medications exceed a very narrow range of temperature, they're no longer a drug. And that clock starts ticking as soon as the power drops on their refrigeration. Have a plan B, a plan C for keeping the drugs, and for keeping access to them for the people who need that access. Pharmacies, hospitals, patients, clinics, field clinics, EMS. Loss of security systems and lighting will cause a number of places to close. There, until very recently, was a policy in major hotels that if the power drops, they had to get everybody out of the hotel. If the power dropped because a Cat 3 storm was right outside in their parking lot, this was problematic. And this did come up in several hurricanes. We had to have some fairly sharp discussions with the hotels to keep them from dumping people into the storm. If you plan for it now, it won't surprise you during the real ones. Next slide. There will be a couple of points of discussion during this presentation. We're not going to stop now, but I want you to consider how have past hurricanes affected access to medical services for your clients, your constituents, your people. You've already been instructed on how to use the Q&A button and so forth to comment to the moderators, and if they can't answer something, they will reach out to me and Vivi as quickly as we can. We'll get an answer back. Next slide. Direct citizen impacts. These almost always happen, at least to some extent. Higher extents, lower extents, that will be the variations. Loss of home lighting and refrigeration. When the lights go out and the refrigerator stops humming, tension levels start to rise in most homes. I'm a professional planner and I have a plan A, B, C, and D, but if it goes to E, then there's problems. Loss of news sources. People want to know what's going on. They will go to incredible lengths to try to find out. And if they can't get real, official, cleared information, somebody will make up things just to tell them. Outages will eventually impact landlines. Landlines have to have electricity, and sooner or later, if the outage is severe enough, the phone lines will go down. This also takes down computer lines. This takes down a lot of things that you may or may not have already planned for. Cell phones, besides the obvious impacts to the cell towers, which most jurisdictions have planned around, just having your cell phone run the battery down. How are you going to charge it up? What is your plan B and C for charging a cell phone? Do you have a car charger that you can run your vehicle and charge it up? And do you want to use up your fuel for the vehicle just to charge a cell phone? There are other options, and we can assist with that line of thinking if you need us to help you. Loss of thermostability. There is a narrow range where humans are comfortable and safe. And if the humans involved are otherwise compromised, very old, very young, compromised immune systems, things like that, their thermostability is a narrower range. So if they are not kept warm enough or cool enough, they become less and less stable, and this can have a definite health impact. And we already addressed the hotel companies issue that I spoke of in the last slide. Next slide. Electric shock. This gets people every time, so I know we have not yet communicated enough on this. Fallen power lines. If the power lines that are usually overhead are now underfoot, don't step on them. Call the electric company if you have the ability to report them. Watch out for power lines that are still overhead but no longer as high as they were. If they're drooping down low enough for you to touch, for your vehicle to touch, there's definitely a danger. Flooded homes. If you can stand in a dry place, turn off power to the home at the main breaker. If you can't, have an electrician do this. And remember, during the storm is not the time to be thinking about who should I call. That's something you can plan. Never turn the power on or off or use an electrical tool or appliance while standing in water. Really, folks? But empirical evidence tells me that yes, I had to say that. Water damaged power tools. Once you have gotten a power tool, a drill, a vacuum cleaner wet, you have to assume it's still wet until you are positive it's dried out, or you can have somebody examine it. If it's still plugged in and you're standing in a dry place, you can unplug it and then wait for an electrician to check this thing. If you're in doubt, okay? Don't take a chance on it. It's not worth your life. Next slide. Electric shock is a big risk for responders. I want you to think about the advice you would give your employees, your volunteers that are showing up to help you, on how to avoid electrocution after a hurricane response, during the hurricane response at work. Think about that. What are you going to warn them about? How are you going to get the message to them and absorbed? Next slide. Food. In the survival hierarchy, you actually worry about breathing, and then shelter, and then water, and then food. But the very first thing people start to worry about is, what am I going to eat? You can last up to 3 weeks, most people, most days, most events, without eating at all, but it's not comfortable in the slightest. And again, if you have any other limiting factors, it can be a positive danger. Spoiled food, contaminated food, and water can make you sick. if you're one of the people who's already compromised, getting sick can kill you. This is not good. This can be planned around. If the food has been sitting in a non-running refrigerator to the point that it is now room temperature, now warmer than refrigerated, it's dangerous. You're going to have to make a judgment call on it, and in most cases, judge no, don't eat it. That means you need a plan B that doesn't require refrigerated food. If you do get sick, how are you going to get to a compromised hospital or clinic over compromised transportation systems? You start to see the things piling up in your way now, right? Here's what you can encourage your folks to do. Stockpile canned food ahead of time. And we're not talking, 2.5 tons of wheat or something here, but have several days of non-perishable food, stuff that don't have to be refrigerated, and ideally stuff you don't have to heat to eat. Keep that ahead of time. Get that before the storm gets there, because as you've seen over and over again, 3 to 4 days before the storm hits, milk and bread and so forth will evaporate from your local stores. It's gone. Keep food fresh. There are rotation schedules for canned goods, for dry goods. If food spoils, throw it away. Don't take a risk on it. Canned food, if it's in a sealed can, non-compromised can, you can scrub the can off and then open it. If you store canned goods inside gallon-size zipper bags, this will save you time, because you won't have to wash those cans off. You'll just have to clean off the outside of the bag before you open it. Much simpler. Use bottled water if you can post-event until you are sure your water is safe. Boil water if you have to use non-bottled water and you're not sure about it, boil it. There are also other methods which are on our websites and freely available in the media for how to treat water, to purify it or to sanitize it. If you have to have safe water to do whatever you're doing, and especially medical procedures, infant feeding, things like that, then use treated water, water that you absolutely know has not been compromised. If you don't know, assume it has been compromised and treat it. Next slide. Carbon monoxide poisoning. Every single event, this claims lives, so we're not done being missionaries on this subject. It's an odorless, colorless gas. It is not carbon dioxide, by the way. It is carbon monoxide. It can cause sudden illness and death. You can't smell it. You can't taste it. You won't know if it's there until it's too late. People might use generators or other things if electricity is out, and they need to absolutely know not to use them in an enclosed area. Certainly not inside the house, but also not inside the garage. You open the garage door, you think it's plenty ventilated, you fire up the generator, and they end up dead. Think about it. Warn everybody you're responsible for about it, and maybe we can get this killer out of the picture finally. Next slide. Don't use gasoline, kerosene, coal burning equipment, any of that inside your home, basement, or garage, especially home and basement, because the gases can pool in these areas and you won't know they're there until it's too late. Outside, and at least 20 feet from a window or a door or an air intake. Know where the air intakes are in your building. You can't avoid the problem if you don't know where the access points are. Use a battery-operated or battery backup CO detector anytime you run a generator or anything else that burns fuel. If you're using a Coleman stove, you need a CO detector happening nearby so that you can get some warning, because you can't smell it or taste it. Don't run a car or truck inside a garage attached to your home, even with the garage door open. Remember what I talked about, pooling the gases. This can occur, and it's been proven to occur. Don't heat your home with the gas oven. It's incredibly inefficient, and you should have another option for keeping warm. If you have a carbon monoxide detector go off, get out. Get out of the structure right then. Call 911, access some help. Next slide. Driving through floodwaters. How many times do we have to teach this? If you can't see the road through the water, don't drive there. It takes far less water to sweep your car off the road than most people believe. It takes far less to sweep your feet out from under you. And most water that you drive through is not clean, pure water. It's muddy water. You don't know what's in it. My God, there could be logs or broken glass or alligators or dead dogs floating through this stuff. Nothing you want to contact. Animals and pests. After an event, the animals will be displaced. Their territory markers will be displaced, and until they reestablish all of that, they will not be acting normally. Pet dogs turn into wolves after an event temporarily until they get their conditions back again. Mosquitoes tend to build up, although this varies depending on the area and the season. Lots of other pests, snakes and so forth, tend to go for high ground, trying not to drown. If your house is the only high ground, guess where they're going? There's psychological harm that happens after an event, and there's a lot of data on it, and it's very, very real. You don't have to be in a war to have post-traumatic stress. All you have to be is after a trauma. Cleanup from injuries. I've been to over 35 named disasters. I've treated an awful lot of workers and homeowners and so forth for burns from non-traditional cooking methods, from touching parts of a generator that they weren't familiar with. Lots of problems like that. Every time, the first hour after the event, people will start having injuries from stepping on nails, from staple guns that get them, from screw guns taking the plywood down. Lots of very, very common things, and most of them, if they just slowed down and relaxed for a minute, they would not have hurt themselves. Mold. This is a big information problem after hurricanes, tropical storms, any weather, cyclonic weather event. Mold is almost always a follow-on to this, and not enough people know enough about it. We have lots of information available on our website. There's lots of other sources of information. Get some, all right? Get some information on it. You won't fear it as much, but you will be able to deal with it. It is an honest problem, and it can, especially for asthmatics or other people with compromised respiratory, it's a very, very real life threat. So learn about it, how to avoid it, how to ameliorate it, how to fix it after it happens. Hyper and hypothermia. Remember, I said humans exist inside a narrow temperature range. If you get them too high, too warm, or too cold, they don't function well. Their brains don't function as well. They make dumb decisions, and it's avoidable. You know these storms are coming. You know they're going to come this year and next year and every year for the rest of our lives. Plan for this. Plan a way to get as cool as necessary. Plan a way to keep as warm as necessary. And as your life changes, as people in your homes or your business age, change your plan. Your plan has to evolve. Next slide. These are some links to resources. Note that most of them are government. There's a Red Cross on there. The one I really want to point up is the very bottom one, spaghettimodels.com. A guy named Mike runs that site. It is a huge page with every one of the spaghetti models on it, every one of the track predictions, the size of the storm, the radar, all of that is on one place. You can go to one spot and look and at least get a snapshot of how things are going with your event. There's links to all of the ones above that. There's links to the government agencies, there's links to Red Cross, there's even links for tracking earthquakes and so forth. So if you are a disaster professional, it's one place you should know about. And I get absolutely nothing from any of these people listed here, so I'm just trying to give you access to information. And that's what I've got. Vivi?
Hi, everyone. Thank you very much, Bill. That was very informative, and I really appreciate all of your years of experience and knowledge on this topic. Thank you also to Kelly and the rest of the EPIC team for setting up this webinar, and thank you to all of you for being here today. I'm going to kind of build on what Bill has been talking about and go to the next step. So we know that hurricanes and storms can cause all of these health problems. What can we do about it, and what communications resources does CDC have that your organization may be able to use this hurricane season during 2019? Next slide, please. So first I'll talk a little bit about our work for the last 2 years. CDC has been working on public health aspects of hurricanes for many years, and a lot of the way we do things now has really been informed by Hurricane Katrina in 2005. And we work within the National Response System with HHS and FEMA, and cover really what are the public health impacts of a disaster. So 2017 was a very intense season, as you probably all remember. We had 7 of the 13 named storms develop into hurricanes, and we were very close to top 15 years. So we saw Hurricane Harvey, Irma, and Maria hit back to back to back as major hurricanes affecting Texas, the Southeast, and our territories in the Caribbean. And then there was Hurricane Jose in New England. Next slide, please. And then 2018 was another very active season where we saw a lot of damage from Hurricanes Florence and Hurricane Michael, and that one affected my own parents in Tallahassee. And I know that people are still dealing with the after effects from those storms. And that's something we'll talk about too, how to assist people with longer term health issues that they're having. Next slide, please. So all of the things that Bill spoke about during his presentation, we saw happening in 2017 and 2018. People drowned, there were carbon monoxide poisonings, there were people who were displaced, long-term losses of power, we were dealing with contaminated drinking water, damaged and destroyed infrastructure, and affected medical facilities. Also, people were dealing with mold in their homes and other damages to their homes. Next slide, please. So I'd like to ask a question. And this is something that we were faced with, and we'll be faced with again and again after a storm eliminates power. We're really losing our major way that we are communicating with people now. So how do we get messages out when there's no power and no internet? And I'd like to hear in the chat box how your organization does this and what plans you have for redundant communications in the event that you do lose power and you lose internet and you may lose cell access as well. And here's just a scene from a month after Hurricanes Irma and Maria in St. Croix, Virgin Islands, and the power lines were still down. Next slide, please. So the way we approached this is we did it in a number of ways. We were very reliant on radio, and we also knew that we'd have to go back to old-fashioned printed information, whether that was signs and posters at places people were going, shelters, at FEMA recovery centers where people are applying for assistance, at grocery stores and hardware stores. And we were able to work with the US Postal Service and with the territory to put together a one-page flyer to get into 50,000 mailboxes within the territory. And so if you've only got one page to tell people everything they need to do to stay safe after a hurricane, what messages do you include? And this was a conversation that CDC had very closely with the Department of Health in US Virgin Islands and with our other federal partners, and trying to determine what were the specific health effects that were particularly affecting this audience, and what information could we give them that was actionable. So we wanted to make sure that the things we were telling them were achievable, things that they could do to protect themselves. And so we chose to discuss safety of food and water, protecting from mosquitoes, being safe while cleaning up, including avoiding carbon monoxide poisoning and avoiding drowning, preventing infectious disease by hand washing, and talking about mental health, which we knew was going to be a long-term issue. Next slide, please. And here's an example. I want to really give credit to the U.S. Virgin Islands Department of Health for building some very strong pre-existing relationships with radio stations. And because of those pre-existing relationships where they had met weekly with the local radio stations in non-disaster time, we were able to leverage that relationship to get information out over the radio. And a lot of people, they didn't have power in their homes, but they would listen to the radio in their cars. And they were still able to get fuel for their cars. So that was a major way that people received information in the weeks after the hurricane. Next slide, please. We also went to health fairs and were able to share printed information at those in collaboration with the Department of Health. Next slide, please. And here's an example of the display we had at the hardware store. One thing we were able to do when talking about cleaning mold from your house, you want to remove as many barriers as possible. So we worked with the hardware stores to ask them to pull together everything a person would need to clean mold out of their house, and had a sample kit and a checklist and a shopping list that people could use as they went around the store so that they could get the brushes, the gloves, and the cleaners that they were going to use all at once. Next slide, please. We also knew that outside of the affected areas were a great number of people who wanted to help and were worried about their families, but they didn't know the best way to reach out to their families, and they didn't know the right information to send to them. So one thing that we created was this one-stop shop for family members and friends of people who were in affected areas. And this has since been adapted so that it can be used during any hurricane or storm as a way for people to share information with their friends. And there's social media to share, there's text messages that you can just copy and paste to send to loved ones. There's even scripts for a phone call. Obviously, people don't need a script to say, hey, how are you doing? We're worried about you, but it gives them ideas of things that you can mention to your loved ones who may be in an affected area. Next slide, please. So I want to share a little bit more about some of the specific materials that we have that are available on CDC's website. And all of these are public access. They're free. You can download, you can print, you can share over social media, you can put them on your own websites. And we're hoping to, in the future, provide more information to make it easier to put CDC information on your own website through microsites. So keep an eye out for that. It's in the works. Here are some public service announcements that we created about mold that were taken from mold infographics, and we put them in social media form so that people could easily share them over Twitter and other social media. Next slide, please. We know that when we're sending social media from CDC, something that has a picture or a video is always going to get more shares and more attention than just a text message. So we're trying to include pictures and videos in every message that we send out. We had a big focus on mental health, particularly how to help children who were affected by the disaster. And this is something that we're still seeing children and teenagers who were displaced by the 2017 storms. Many people from Puerto Rico who may have moved in the aftermath or temporarily or permanently. Those challenges stay with people, whether they are children or adults. It's something that can affect health for years to come. And we know that making sure it's something we address head on and face is helpful. We also translate, almost all of our materials are available in English and Spanish, and this is Disinfecting Your Water in Spanish. We are able to translate into other languages as needed depending on the audiences for a particular disaster. So that's something that we don't keep these materials in every language fully updated, because we know we're making changes too often to be able to keep that realistically updated in every language. But for a certain disaster, if health departments or partners are noticing a need for specific languages that we don't have, that's always something that we take requests for, and we're willing to work with you and try to help those materials get translated into the languages that they're needed in. Next slide, please. As Bill said, carbon monoxide is a major concern. It is when we've done surveillance on health impacts and deaths following a storm, we always see carbon monoxide deaths. We always see driving and floodwater deaths. And those are two that we've been able to count. Another major way that people are affected, a category of health effects, is people who have a chronic disease who their care is affected by the storm, whether that's because their dialysis or oxygen is affected by power outages, or they're not able to get their medicine on time, their insulin. We are getting better at being able to count these as disaster-related illnesses and injuries and deaths. And so I don't know that we fully understand the scope, but it's many, many people. And it's certainly an area that we need to focus on, helping people with chronic disease get through the aftermath of a storm. Next slide, please. National Weather Service does a great job with their slogan, "Turn around, don't drown." We and our partners promote this. We love your help promoting this. Whenever there's water on the road, people will get into car accidents, and it's one of the, if not the number one way that people die during and after a storm. Next slide, please. We partner very closely with SAMHSA on mental health messaging after a storm. They provide a disaster distress hotline that gets a lot of use after a natural disaster. And so one thing that we as partners can do is promote this number and help people know. And now they even have a way that you can text to it instead of talk if you don't want to talk on the phone, because many people are more comfortable with texting. Or they may have text access on their cell phone when they still don't have talk access after a storm. Next slide, please. So now we'll talk a little bit about how do we make sure that we're on the same page with all of our partners? And this actually affects the CDC itself. So as you know, CDC is made up of a number of different centers, and they each have a different health focus. We have a chronic disease center, an infectious disease center, and of course, where Bill and I work, the Center for Environmental Health and Agency for Toxic Substances and Disease Registry. So how do we make sure that we're coordinating internally and externally so that everyone is on the same page? I mentioned that a lot of the way we approach hurricanes now has been informed by Hurricane Katrina. And after that storm, CDC realized that there are a certain number, you can divide hurricane response and recovery into different phases, and you can plan out messaging based on the phase so that you can anticipate the questions people will have, the health issues that they will have, depending on how many days it's been since the storm. If everyone knows approximately what the phases are and they can anticipate the issues that we'll face, it helps make sure that we're all talking about the same thing at the same time, and that coordination of messages increases the impact of the messages that we're having. If people are hearing a different message from every federal agency and every partner, they're not sure where to turn. They don't know which one is the most important, and they kind of don't know where to look. So we've found that the more we can emphasize and help share our partners' messages, and we can be on the same page, the more impactful our messages will be. Next slide, please. And this is a basic outline. By no means does it have every topic for each phase, but I wanted to show you in general what this looks like. You know, in the first days before landfall and immediately after landfall, you're really thinking about first evacuation guidance, how to find a shelter, how to leave your home safely. Do you have what's in your disaster kit prepared? Although hopefully you'll have done that months in advance and you'll have it at the ready. Flood safety, power outage risks. It's only a few days later that we start to look at things like food and water safety, mold. It takes mold a few days to grow. So if we're talking about mold right as the storm is hitting, people might be listening to that message instead of what they really need to be hearing about staying off the roads if there's water on the roads. And then longer term, we're looking at coping with trauma, re-entering your home safely, dealing with injuries. Next slide, please. So the most important thing I can say is that we've got to keep our lines of communication open with our partners. We are very appreciative that the EPIC team at CDC allows us to reach all of you and let you know during a storm. We can share our key messages and make sure everyone knows, this is what CDC is saying. We also have regular calls with all of our federal partners and our state partners to make sure that we agree on the main messages and that we're all kind of in coordination with each other to get health messages out. We also know that CDC doesn't lead on every message. Sometimes it may be EPA or FDA, and we're helping amplify their message. So talking to each other can make sure that we're all in sync and can agree about who's in the lead. And when we have disagreements, we're able to discuss them and come to a quick resolution. Next slide, please. So here's a big, huge slide. I can tell you, if you go to that top link, you can find all of these other links, but I did want to pull out some that I thought were particularly important and particularly helpful. And I just want to highlight a couple of items here. So if you go to the hurricanes and tropical storms link, you can see the before guidance and the after guidance. You can go to food and water safety pages, which has all of the detailed information and infographics about, how long food stays safe in your refrigerator after your power goes out, how to disinfect water. Like Bill said, we encourage use of bottled water and then boiling or disinfecting if needed, and always listen to local authorities to find out what's the best approach. Boiling water can get rid of biological contaminants, but it can't get rid of chemical contaminants. So it really depends on the situation. Power outage safety materials, cleanup safety materials, mold. And I just want to highlight that within the mold information, it's not only, how to clean your house safely, make sure that people who have, who are children or people who have immune system issues are not there while you're cleaning mold, but it also has information for clinicians on how to recognize diseases that may be related to mold infections. And it also has information for people on how to access other resources on more professional help. Coping with a disaster information for professionals and response workers. We work very closely with the National Institute on Occupational Safety and Health, NIOSH, which is part of CDC and focuses specifically on professional worker safety. The How to Help Loved Ones link is the link to the social media package that I mentioned earlier, where people can check on friends and relatives who are in affected areas. We have a whole data site of printable educational materials. And these are mostly the ones that are CDC materials, but we know that partners have a lot of really great materials too. For example, the National Public Health Information Coalition, or NIFIC, has a site where they've got a repository and a repository for flood communication materials that includes a lot of great materials from state health departments as well. And finally, we have public service announcements that are audio, some are video, and some are text that can be used for texting and sharing over the radio. So this is all that I have. I think Bill and I are going to take questions for a little while now. Thank you very much for your attention. If there's something that I didn't address that you'd like to see addressed, or something that I don't have the answer to today, we can definitely find those answers for you and get back to you. Thank you.
Thank you, Vivi. We will now transition to our Q&A session. Jonathan, can you read the first question?
I can. The first question is coming in from Daniel Shaneholtz. And Daniel's bringing up opioid addiction and some of the issues that brings up during an emergency. He says, opioid addiction in a catastrophe is particularly problematic, especially if the DMAT teams have narcotics or are thought to be holding them. How are medications, eyeglasses, hearing aids, wheelchairs, etc. replaced during a catastrophe?
Do you want me to take that one, Jonathan, or do you got it?
Well, yeah, Bill, why don't you go ahead and take that one?
Go ahead, Bill.
Short answer is they're not in any coherent form. The method of replacement for any of those will be different. It will rely on local planning, on local capabilities. What works for Miami Beach, what may or may not work for Mexico City Beach. The opioid addiction problem in itself is multifaceted. It involves both chemical addiction and the mental health aspects, which have to be addressed in your planning, because addressing them immediately post-event is terribly problematic. And it will be competing with other aspects of the catastrophe for attention. And also, please bear in mind what you just stated, the difference between a disaster and a catastrophe. We handle emergencies every day. We handle disasters pretty well because of all of our planning and practice. Nobody handles a catastrophe. You get through a catastrophe, and then your planning and your workers will get you through the after effects eventually. Catastrophes, by their very nature, destroy the system. And you're not going to plan your way around it. You can only plan around some of the effects. Now, wheelchairs, hard, durable goods, and so forth can be stockpiled. They can be acquired through purchase or rental, but that implies that the people who need them have access to money or have access to transportation and have access to people who care in their immediate area that will see that they have been evaluated and need to be re-equipped. That's just one item. We can help you address some of the other stuff, but all we can do is help. It's your house.
Thank you, Bill. Vivi, this next question would be for you. It comes from Jane, and I'm going to expand a little bit upon what she asked, which is this. Are copies of the direct mail information available for facilities to hand out to staff and families? And then I know we have a lot of printable products as well, so I want to see if you could comment on sort of the practicality of that.
Thank you. That specific direct mail product was a one-pager that we developed with the Department of Health in the Virgin Islands that was pretty specific to that time and place. We're working on creating a more evergreen one that could be used in more situations. So right now, no, but we do have all of the printable materials, the other ones that I mentioned, available on the educational materials page on that resources slide. And if there's ever a specific need that you see that we don't have on the CDC website, that you feel like, we could really use a fact sheet on this, our constituents need it, and when we want to have something, please let us know. You can reach out to Jonathan's team and they can pass that on to the program so that we can know what there's a need to develop. And we definitely see that as a two-way process, that we want to make sure that we're creating materials that are useful for people. I also just wanted to quickly mention, in addition to what Bill said, HHS does have a program called the Emergency Prescription Assistance Program, EPAP, that is able to help people with some, and this doesn't directly address opioid addiction, but it does help with prescription medicines that some people might not be able to access easily after a disaster, particularly if they don't have insurance. And more information on that can be found at phe.gov.
Excellent, thank you. The next question I'm going to take is from VHAV, who asks, and I'm going to address this question first. It says, will there be a class on managing volunteers post-hurricane? And this gives me a great moment to plug next month's EPIC webinar, which will be on response worker safety. So please look out for that. And do either of you know of any other information on managing volunteers post-hurricane?
Vivi, what's that? Is it VOAD that I'm trying to think of here?
Yeah, the National Volunteer Organization.
Active in Disaster.
Active in Disasters. Yeah, that's a really good resource. And I believe the Red Cross might also have some information on that topic.
Yeah, that's the one. And as a one-stop, you can do a quick search online for VOAD and be in touch with lots of people that deal with that specific question. And it is a huge one. At the World Trade Center, we had to rent on an emergent basis 6 warehouses just for the inappropriate donations that couldn't be burned, couldn't be thrown away. They were sent in good faith and were utterly inappropriate for that type of disaster. And it took away precious resources in manpower and time and money that we needed to apply to what was actually wrong. So managing volunteers, managing donations is a huge issue, and there's a lot of stuff that can be taught on it, and it won't happen in this lecture, but it's available, so reach out to us.
Great. Okay. The next question comes from Gavin McGregor Skinner, who says, we have over 100 dialysis patients in our community. In the 2017 hurricanes, we had 76 patients and some died. We still do not have a plan for these patients other than evacuation prior to the storm. What are others doing for a post-response plan for dialysis patients? And Bill, that sounds like something that would be in your lane.
Evacuation is your best move. If they're not there to be harmed, they won't be harmed. Knowing, of course, that that's not going to be a 100% answer. If they could have been evacuated, they would have. They wouldn't be in harm's way. There are plans available. There are planning organizations available that can help you lean on that. And a quick way to access some of it is to reach out to Red Cross or to FEMA and access some of the existing planning already being done on that. Bear in mind the key components of compromised dialysis systems are supplies and access. And the more planning you can put toward clean water and available power and transportation, the easier it will be to deal with a dialysis crisis. In the Berry response, the predominant method of dealing with it was to dialyze these people ahead of time, close to onset of the storm, but not during it, so that they had some time. And the ones that were so critical, so fragile, get them out of the way. But there is portable dialysis. There are other methods for dealing with this particular issue.
Thank you. The next question comes from A. Messer, who asks if CDC has advice for state EOCs who are working with situations where people might have pet emergencies.
Go for that one, baby. You shaking your head.
Sure. If you mean pet emergencies, I'm assuming you mean people who want to protect their pets, their cats and dogs and other animals during a disaster.
That is the interpretation I have.
Okay. Yes, we do have a web page on our disaster website that's focused on helping your pets during a disaster, helping people locate pet-friendly shelters, and some considerations. You know, we recommend that in a disaster kit that people have for their families, they also include food and water for every pet that's in their household. And it's certainly something that we know happens. We never want to see someone who's unable to evacuate or doesn't want to evacuate because they're worried about their pet, you know, who many people believe is an important part of their family. So we want to make sure that people know how to get help for their pets as well as the rest of their beloved family members.
One preparation you can carry out right now to get ready for the next one is to go ahead and have accurate printed medical history on your pets, and also printed pictures of you and your pet, so that if your pet is separated from you, either during the event or at a shelter environment, you can show that, yeah, that's mine and I own them, and here's a picture of us. Okay, that's available from your veterinarian, by the way. They've really bought into this type of preparation. Keeping good relationships with your veterinarian, they will store records on you and your pet. Microchipping is an option, things like that.
Okay. This one will go to Vivi. I'm actually going to list some of the things that people mentioned for redundant communication methods. Radio, satellite phones, ham radio, banner planes, mobile loudspeakers, and live speaking at churches. I know, Vivi, you've actually been deployed in this kind of a setting. What's your experience with some of these methods?
Those are all great and really creative ideas. You know, partnering with faith communities is something that we definitely do. It's a really good way to get information out, to go to churches and other types of religious gatherings after a disaster. It's somewhere people are going anyway to kind of rebuild that sense of community, and they're getting a lot of leadership and good information from their pastors and rabbis and other clergy. So we definitely want to work with them to make sure that those clergy have access to health information and resources that they can share them. I also, I love the shout out to ham radio. I know when I attended the VOAD meeting a few years back, spoke with the ham radio folks, and they're very active in emergencies and getting life-saving information to people. While I have the floor, I know we're ending soon, and I just wanted to make sure to point out one of the resources, and thank you everyone for posting all of these resources in the chat. I hope everyone has a chance to scroll up and down and see the links that everyone is posting for each other. One of them that I didn't call out during my presentation, but that I think is really important is, so I mentioned that during a disaster, CDC shares its key messages with all of our partners. And we actually, this past year, turned the 2017 Key Messages document into an evergreen document that's available on the website. If you scroll up a little bit, Jamie Vasquez posted it. And it's meant to be a source document on all topics from which partners, state health departments, non-government partners can use that information to create their own health messaging in the format that works best for their audiences. So please take a look at that if you have a chance. Thank you, Jamie, for bringing that up.
Two resources we used during Hurricane Andrew and several subsequent storms, and they'll be resource specific. We used commercial blimps with the marquees to get information out at night, floating over the areas that were affected. They didn't require that the recipients have any power or have anything except a view of the night sky. Also, the reverse call system for cell phones was used in a number of events very successfully, especially comes to mind carbon monoxide warnings.
Okay, that's great. And with that, I think we're running out of time. So I'm going to hand the floor back to Kelly.
Thank you, everyone. Thank you, Bill and Vivi and Jonathan. Thanks for everyone joining us today for the webinar. If you have additional questions, if your question didn't get answered, please do email them to EPIC, EPIC, @cdc.gov. As a reminder, today's presentation has been recorded, and you can earn continuing education units for your participation. Please follow the instructions found on emergency.cdc.gov/EPIC. The course code is EPIC 0717 with all letters capitalized. Thank you again to everyone, and goodbye.
Thank you.